Thank you very much indeed. James Davis.
Thank you, Chair. I'm interested in bricks and mortar of care homes. So, in other words, the suitability of the housing stock as regards care for those with dementia. To what extent do we think that the existing stock is fit for purpose? Caroline, first, please.
I think we know that care homes are very variable. Also, I think, given the horrible experience of this pandemic, it's clear that if you have a very large site, which isn't easy to be able to compartmentalize, then it's quite hard to do infection control. And infection control is going to have to go on being a really important attribute for care homes going into the future, I think. And we can never again tolerate the high levels of deaths from flu, for example, in care homes that we've seen year after year. So I think we're moving into a different phase really for care homes, and the capacity to be able to do good infection control is going to be really, really important. I mean, on the whole, I think smaller tends to be better in terms of quality of care. But in the end, it's probably as much about culture as it is about sheer bricks and mortar.
Mm-hmm. I was just aware that during the pandemic, there were multiple often converted Victorian care homes that didn't have ensuite facilities and isolation facilities. So yes, they were small, but they didn't have perhaps what we would expect in this day and age. So does there need to be more attention in that respect? Fiona?
So I think that we know that one of the major crisis points, and I think Jonathan described this so well earlier, is that point at which you need to find residential care. So I think we need to think about it across the whole kind of journey, so that actually there's time. This is why the diagnosis is really important, so that you get it at a time in which you can make future plans. I think the other point I would make is that we have a moment with the government considering its new dementia strategy. So this is very much led by DHSC, but we would seek at Alzheimer's Society for this to be a cross-government initiative. So thinking about how we, not only housing, but transport, how it links to bays, so that we have that kind of breakthrough innovations and research that we need. So I think there's a clear moment now to think about the kind of transformation, not only of the kind of the health and social care piece, but actually that wider kind of government initiatives around dementia.
Mm-hmm. Thank you. And Sarah, when it comes to upgrading the standard of care homes, is there a disincentive for local authorities? Because if there is better accommodation, it costs more.
I don't think so. When I was a director in a local authority, we worked with an Industrial and Providence Society to actually recommission a whole series of replacement homes to upgrade and to move, to make sure that those ensuite facilities and all the right things were available for everybody, and they were delivering, good quality care to people with dementia. So, local authorities want good care, but obviously there is an affordability issue. But I do think that we need to think about whether, even for people with dementia, and even for, obviously there is a role for nursing homes and there's a role for care homes, but there's also a role for specialist extra care housing. I know of an excellent, relatively small extra care housing unit focused on people with dementia, which actually settled people who had been in secure accommodation before, because it's a different approach and a different way of working. So I think when we're thinking about bricks and mortar, we need to think not just about care homes, which of course must be suitable and appropriate and what we would expect in this day and age, but also about housing, and then about people's own homes, because two-thirds of people with dementia live in their own home, and that own home could be an extra care housing unit because that is your own home. But actually, a lot of what we learned on the APPG on the inquiry into housing for people with dementia is that there are things you can do in your own home to adapt if you know early enough and you can learn. And there was a great contribution from a lady called Wendy Mitchell, who's written a book about this. She has dementia, and she explained how she had adapted her own home, learning by doing, working out tactics and strategies, as Jonathan said. But actually, you can help people with that if you get it right. Yes,
yeah. I had a great tour of an extra care housing development in my constituency, in fact, just days ago. So you're quite right. On a different topic, Dementia Friends, the Dementia Friends agenda, Fiona, how is that going? Has it reached its conclusion? Is there more to do?
I think there's more to do, and I think there's more to do not only on awareness, but actually about inclusion, because I think this comes down to what really matters for people with dementia, and that's about relationships, being connected to their loved ones, but also to the communities in which they live. So I think there's a lot more to do around that, and it's something that Alzheimer Society, we're very proud to kind of run flagship initiatives around this. But I think the more that we can do to be aware, but also to kind of, again, it comes to the housing stock, to have inclusive housing stock that's kind of mixed. There's some great examples in parts of Europe where you have young and old living together, so that you've kind of got a link to the community. I think for us, it's about moving it towards an inclusivity agenda as well as just an awareness piece.
Mm-hmm. And it was very much pushed, wasn't it, by David Cameron when he was Prime Minister. Does the government need to do more to push the dementia agenda and dementia-friendly communities and so forth?
I would say that goes back to my earlier comments about having a cross-government strategy that really puts dementia, at the heart of all of the government thinking in different areas, because it's not just going to be DHSC or the health and social care system that addresses this. So we would want to see this being right at the heart of the government agenda, because I go back to my initial point, this is the biggest health and social care challenge that we're facing outside of infectious diseases. And dementia is still, in the top 10, if not the first, for people dying. So huge amounts to do.
Mm-hmm. Thank you, Chair.